We welcome you to Cancer Episode 2. Here we aim to introduce you to the differences in incidence of cancer between the Western world and East Asia. We provide you with a plausible rationale for this difference. We suggest foods and substances to help boost your immune system and thus give us a fighting chance against cancer. We introduce you to graviola and its cancer fighting ability. We discuss the mechanism by which graviola brings about its effect. We also introduce you to fucoidan, AHCC, and lactoferrin, and we assess their value in the fight against cancer. We'll introduce you to cesium chloride, but under caution that it should not be used except under medical supervision. Let's look at cancer in the West. In the previous episode, we have seen that cancer is winning both the battle and the war, leaving us with very few recent successes in this ongoing fight. Let's look at the numbers. Let's look at what the numbers are telling us. The incidence of cancer, for example, in the USA is 352.2 per 100,000 individuals. In Belgium, that number is 345.8 cases per 100,000 individuals. To understand what can be done differently, we look at the countries with the lowest incidence of cancer around the world. We found 8 countries falling in that group of countries with the lowest incidence of cancer around the world. 4 of those countries were African countries and 4 were Asian countries. We have been advised that the African countries are guilty of underreporting, so we have chosen to exclude the data. We focus our attention on countries from Eastern Asia. Compared to the incidence of cancer in the USA and Belgium, the incidence of cancer in Asia is reported as 186 per 100,000 individuals. So when you compare that with the incidence in the USA of 352, we have the incidence of cancer in Asia to be about 48% of the value or the numbers in the USA. If we go further into Southeastern Asia, we have an incidence of 138 cases per 100,000 persons. This is only 39% of the incidence in the USA. The question then becomes, is there anything we can learn from Southeastern Asia that we can adapt to bring our cancer incidence down? I leave you to pause. I pause to allow you to think about this. The incidence of cancer in the Western world has increased by 12% between 1990 and 2020. That is, in the space of 30 years, we have had an increase over the numbers in 1990 of 12%. And that rate of rise is projected to go at 2% every year until 2035, in which cases we should be having an incidence of cancer of about 625 cases for every 100,000 persons. So the incidence is expected to rise even higher than it currently is. So is there anything we can learn from our neighbors from the East to help put a dent in this cancer explosion? Let's see. Several explanations have been advanced for a low incidence of cancer in the East Asian countries. Among them are the fasting practices, the spices in the food, and a low rate of smoking and alcohol consumption, as well as a genetic predisposition. In Okinawa, Japan, for example, there is less cancer than in America, and women there live longer than any other woman on the planet. Japanese cuisine is considered among the healthiest in the world. Japanese eat half as much meat as Canadians and twice as much fish and seafood as their counterparts in Canada. Additionally, they consume quite a bit of soy. This combination is an important source of what we call isoflavones, which have anti-cancer properties and has been advanced as an explanation for the low incidence of breast and prostate cancer among Japanese. If we go back to Okinawa, Japan, we see a staple of the Okinawans' diet is a slimy seaweed called Laminaria japonicum. Residents consume about 1 gram of this brown seaweed per day. This contains about 5 milligrams of a substance called fucoidan. Fucoidan has been identified since 1990 as a primary immune boosting substance, and it has been studied extensively for its cancer fighting ability. We pause here to recall that our internal defense mechanism is our immune system. So anything that improves our immune system improves our ability to fight off cancer. So hence, the fucoidan found in brown seaweed is one step in the right direction. In one study, I'm going to give you some data which might be helpful in understanding the role of brown seaweed in fighting of cancer. In one study, female rats were injected with known cancer-causing agent. Half these rats were fed brown seaweed containing fucoidan, and the other half were fed a standard diet. The animals were monitored for 6 months. The fucoidan-fed rats developed fewer tumors than those fed the standard diet. Additionally, the cancer developed more slowly in the fucoidan-fed rats. In another study, oral and intravenous doses of brown seaweed were proven to be 61.9% to 95% effective in preventing the development of cancer in rats injected with sarcoma, which is a very aggressive cancer. So I'll repeat that again for emphasis. In another study, oral and intravenous doses of brown seaweed proved from 61.9% to 95% effective in preventing development of cancer in rats injected with a very potent carcinogenic substance called sarcoma. How does it work, I hear you ask? Fucoidan fights cancer in numerous ways. It causes rapidly growing cells to self-destruct, in other words, to die. As we said, that was one of the strong points of cancer. It's failure to die. So anything that encourages death in the cancer cell would be moving in the right direction. B, fucoidan interferes with cancer cells' ability to adhere to tissue and so prevents them from spreading. Remember, one of the concerns we have is local spread as well as distant spread of cancer cells. So anything that prevents that would help to be fighting against cancer and its ability to spread. C, it enhances, that's fucoidan, enhances several immune mechanisms. We go back to the immune system again. So anything that helps the immune system gives us a leg up in the fight against cancer. This fucoidan is able to enhance our immune system by stimulating some white blood cells, which are one of the fighters in our immune system against cancers. It also allows the production of interferon, which fights against viruses and the ability to replicate. It also further enhances the ability of macrophages to destroy cancer cells. Fucoidan also works synergistically with other cancer drugs. So not only can it work on its own, but if you have it in combination with other anti-cancer drugs, it makes the ability to fight and win or defeat cancer cells much better. So we speak about brown seaweeds. Is there anything else that we can use to enhance our ability to fight off cancer? I introduce you to graviola, a fruit called soursop, which grows in tropical rainforests. It has been found that this plant has unique anti-cancer fighting properties. Every component of this plant is effective against cancer. The root, the bark, the leaves, the fruit, and the seeds. All of those can fight against cancer, and all of those have successfully been used to fight against cancer. Whereas cancer cells often evade the natural process of death, extracts from the leaves of graviola encourages cancer cells to die. So again, this is a major step in trying to rid our bodies of cancer. Graviola also blocks the spread of cancer cells from one area to another. It scrambles the signals and blocks pathways that controls the growth and life cycle of cancer cells. Graviola, by starving cancer cells, cause them to die. Cancer cells resist the tendency to undergo pre-programmed cell death. They are through a variety of mechanisms able to evade this natural step in the cell cycle and so do not die. Graviola, though, can overcome this cancer cell's resistance to death and cause them to die. Graviola additionally inhibits the spread of cancer cells, thereby thereby halting the cancer cell's ability to spread beyond its site of development, and so it gives our immune system another chance to tackle and destroy the cancer cell. We have also indicated that to overcome the host, cancer cells depend on a variety of signals. Graviola is able to scramble those signals and render them less effective. Additionally, graviola also starves cancer cells, which results in their death. We come on to other natural anti-cancer food, that is, foods that help our body's ability to fight off and possibly defeat cancer. We have seen the inclusion of brown seaweeds in the diets of Okinawans, and we see the magic it has worked in terms of the incidence of cancer. The incidence of cancer in Okinawa is about 39% what it is in the Western world. Obviously, that is a step in the right direction. We have seen the role and anti-cancer properties of fucoidan, that is the active agent in brown seaweed. And we know that mushrooms make a significant contribution to Japanese diet. Could mushrooms then be incorporated in the fight against cancer? I'll leave you to think about this for a minute. Obviously, if it's working for the Japanese, it may be working for us too, don't you think? A mushroom extract from several medicinal mushrooms have been combined in a formula called AHCC, that's activated hexose correlated compound, which has been shown to have cancer-fighting properties. This compound is believed to exert its anti-cancer activity through boosting our immune system. Again, we go back to the fact that our immune system is our local resident fighter against cancerous cells or cancerous groups. So anything that boosts our immune system is helping us protect our bodies against the development of cancer. How does it work, I hear you ask? AHCC stimulates cytokine activity. Cytokines happen to be elements of our immune system which in various ways fight against cancer cells and other infectious agents to render us free of those conditions. There's a particular area of interest I want you to note. AHCC increases the formation of explosive granules in natural killer cells. That's a type of cell found in our immune system. It's interesting in the sense that it talks about explosive granules. They actually act as hand grenades. How do they do that? These explosive granules, the cells of the explosive granules, when they're activated, they bind to cancer cells, release the explosive granules, and these explosive granules explode in the cancer cells, hence destroying them. But interestingly, these explosive granules are not damaged or destroyed. They can continue on the explosive exercise. So as such, that is a step to ensure our ability to fight off cancer is increased or improved. Additionally, AHCC increases the number and activity of lymphocytes and brings about a 200% increase in T cells. Again, those are another type of cells which form part of our immune system. I think you remember about interferon, which is a substance that helps to fight against viruses and also enhances our immune system and the natural killer cells. AHCC increases the amount of interferon available in our circulation. AHCC also increases the formation of a substance again involved in our immune system called tumor necrosis factor, which, as its name indicates, fights and destroys cancer cells. Cytokines, of which there are several kinds, play an integral role in our immune system. So if AHCC boosting our cytokines, it similarly boosts our immune system, thereby giving us an additional ability to fight against cancer cells. AHCC increases the number and activity of a type of white cell called lymphocytes by 200%. These lymphocytes are integral in fighting viruses. So the more lymphocytes you have in your circulation, the more effective your fight against a virus and other pathogens would be. This activity is further enhanced through the increased production of interferon, which we have met on at least 2 occasions before. The interferon is one agent that helps to fight against a virus and try to prevent them from dividing. Further, HCC enhances the activity of tumor necrosis factor, which, as the name indicates, destroys a tumor. So by AHCC enhancing the ability of of this tumor necrosis factor, it is more efficient in bringing about the destruction of cancer cells or cancer growth. Now we talk about lactoferrin. For those who are involved in early production of milk, the term lactoferrin comes to mind. Why do I say that? Lactoferrin is an important component of the first secretions from the breast of a pregnant woman after she has given birth. It is part of what we call the colostrum. Now, how does lactoferrin help us? It is found that lactoferrin starts appearing in the human's body from the 14th week of pregnancy, but its maximum production is at about 3 or 4 days after delivery. This colostrum is rich in lactoferrin and restores the immune system. Let me just interject here to say that pregnancy is a relatively immunosuppressive state. It's easy to understand why that is so. The baby of the pregnant mother is not the same as her. So obviously, if the immune system was not suppressed in the pregnant woman, she would destroy her baby and get rid of the baby. But by suppressing the immune system, nature has tried to develop a means by which a woman can carry her baby. Now, by the production of colostrum, which happens about day 3 or day 4 maximally in the postnatal woman, that woman after she has given birth, it restores her immune system. So what we find, the lactoferrin, which is a major component of colostrum, binds to iron in the blood, and by binding to iron, it makes the iron less available to the cancer cell, which needs iron, to the bacteria, viruses, and other pathogens which may require iron. So by starving them of iron, it sort of destroys the agent. So if you have lactoferrin in the colostrum, that lactoferrin binds to iron and makes iron less available to agents which require it for their growth. Additionally, lactoferrin activates specific strands of DNA. We have heard ad nauseam about DNA. You're not my DNA. This is my DNA. That's my DNA. But DNA are useful for genes necessary for launching an immune response. Lactoferrin is the only substance that is able to instruct DNA to develop into particular genes. Lactoferrin contains antibodies against a widespread range of bacterial, fungal, viral, and protozoal pathogens. It corners cancer cells, starves them, and signals to white cells their precise location where they can be found and destroyed. So we say lactoferrin activates specific strands of DNA which are useful for genes necessary for launching an immune response. It is unique in that it is the only protein with that ability. Lactoferrin additionally contains antibodies against a wide range of bacterial, fungal, viral, and protozoal pathogens. It corners cancer cells, and hear this, it starves them, so it corners them and starves them, and then it signals to white blood cells their precise location where they can be found and destroyed. So lactoferrin has a tremendous role played in our immune system and our ability to fight cancerous agents. We now talk about AHCC, that's activated hexose correlated compound. As we said before, it is a derivative from a number of medicinal mushrooms, and it increases the number and activity of a type of white blood cells called lymphocytes by some 200%. These lymphocytes are active against viruses. We talk now about cesium chloride. Cesium chloride blocks glucose from entering cancer cells. If you can recall, a cancer cell needs around 200 times more glucose than a normal cell. So by cesium blocking the entry of glucose into the cell, it sort of starves the cancer cell, and hence with starvation the cancer cell would die. But however, cesium is not straightforward as this. It interferes with the potassium levels in circulation and therefore should not be used except under guidance from a medical personnel. The reasoning, if you have too much potassium in your circulation, it can be deadly. If you have insufficient potassium in your circulation, it can also be deadly. Hence, you don't want to have any chances of self-medicating when in fact you could be playing something that could take your life. Additionally, cesium, if it gets nudged or lodged against the walls of your bowel, it can eat its way into your bowel walls and cause what you call a perforation, or like a hole in your bowel. So you don't want to take chances and use that unless you're under medical supervision. It is found that cesium chloride, despite its ill effect, is more effective when combined with a compound called DMSO, that's dimethyl sulfoxide, which allows for easier penetration of the substance into the cell. And this combination, that is cesium combined with DMSO, better targets cancer cells. Hence, it will be more effective in terms of destroying cancer cells. Now, we spoke about a number of different substances. We spoke about AHCC, graviola, fucoidan, and the question I'm sure you're asking is, where can I find these products? Graviola can be found as a fresh fruit in many Afro-Caribbean food stores. A variety of the plant extracts also can be found on Amazon. AHCC can also be found on Amazon. So too can fucoidan. It can be purchased from Amazon. We mentioned cesium chloride, but we advise against its use outside of medical supervision. The first three substances are not known to produce any significant side effect. That is, graviola, AHCC, and fucoidan has no noticeable or damaging side effects. Although in graviola it is reported to be associated with movement disorders, and it can interfere with the signals from imaging studies. So it could probably give you not so accurate readings if you're on graviola and you have something like a CT scan or an MRI study. Now we sell, these are the things you are to eat, to use. They will help you. AHCC will help you. Fucoidan will help you. Soursop or graviola will help you. Are there any things that we can avoid to prevent us from increasing our chance at getting cancer? Let's dive in. As far as dietary intake goes, we have seen or suggested the benefits to the consumption of fruits, seaweeds, and mushrooms in the fight against cancer. But there are other vegetarian types which can help in the fight against cancer. I give you a short list. Among the various substances we talk are beet, radish, cabbage, cauliflower, broccoli, Brussels sprouts, green leafy vegetables, garlic, tomatoes, and berries. In addition to those foods that we can eat or we should use, there are certain foods that will be best off trying to avoid. Among them is red meat. Red meat is a major cause of bowel cancer. Red meats include beef, veal, lamb, and pork. Processed meats such as ham, bacon, hot dogs, salami, and other cured meats are also associated with bowel cancer. Processed meats and more than 18 ounces of fresh meat a week are most strongly linked to cancer. I'll give you some data. In Uruguay and Argentina, the rates of breast and bowel cancer are among the highest in the world. And hear this. The main type of meat consumed in these countries is beef. In these two countries, the consumption of beef rank first and second, respectively, in the world. So is that coincidence? I guess not. Hungary had the highest overall rate of colorectal cancer in 2020. The traditional Hungarian diet is characterized by the consumption of high amounts of white bread and refined grain products, preserved vegetables, processed meat, and lard. Since 2014, there has been an increase in the fat and saturated fatty acids intake and a decrease in the fruit and vegetable consumption in Hungary. Interestingly, the lowest incidence of bowel cancer is found in India and Asia. There are countries in which the foods are more spicy. In fact, in India, the consumption of meat is the lowest in the world. Coincidence again? I guess not. A country with the lowest incidence of meat has the lowest incidence of bowel cancer. One with the highest incidence of meat, or red meat, has the highest incidence of bowel cancer. Would you say that's coincidence? I don't think it is. Current research shows that there are certain naturally occurring chemicals in red meat that causes it to be carcinogenic. When heme, which is part of the component that gives the meat its color, and it's a necessary component of hemoglobin, is broken down in the gut, it forms a chemical called N-nitroso chemical. Current research shows that there are certain naturally occurring chemicals in red meat that cause it to be carcinogenic. When heme is broken down in the gut, N-nitroso chemicals are formed. These damage cells that line the bowel, which can lead to cancer. With processed meats, the result is the same, but the mechanism is slightly different. In processed meats, the nitrite and nitrate preservatives used to preserve the processed meat produce these N-nitroso chemicals that leads to bowel cancer. So not only can we protect ourselves against cancer by eating foods that enhance our immune system, but there are also certain foods that either directly or indirectly induce changes in our bodies that leads to cancer, and we would do well to avoid it. This is the end of section on cancer, episode 2. We'll just review what we covered in that episode. We have introduced you to the difference in the cancer incidence between the Western world and Asia. The major difference being the diet. We have learned that Japanese have about the healthiest diet in the world, and we have learned that Okinawan women have the longest lifespan in the world. We have identified some natural foods which enhances our immune system and plays a credible role in the fight against cancer through different approaches. We have explored the value of graviola, AHCC, fucoidan, and lactoferrin in the fight against cancer. We mentioned cesium chloride, but advise against its use, except under medical supervision. We have been able to show the association between red meat and bowel cancer. Finally, I will share a true story with you. The story is about two patients. We call them Sister A and Sister M. Both patients developed a breast lump. Sister A felt a breast lump, ignored it. It got progressively bigger, and she kept it a secret. Only her husband and herself knew of the problem. Sister M, on the other hand, felt a breast lump and sought medical advice immediately. The breast lump was biopsied. It was found to contain cancerous cells, and she had that lump removed. She is still around even after 4 years. Sister A, on the other hand, was dead within 6 months of her diagnosis. The cancer had already spread throughout her body. The message here is clear. The earlier a cancer is found and treated, the better your chance of survival. Thank you.